My name is Dr. Rami Batniji. I'm a facial plastic surgeon and have practices in Newport Beach and Beverly Hills, California. The Sylfirm device, which is a microneedling and radiofrequency device, really works nicely to help address a variety of conditions that patients may experience. One of the reasons we brought the Sylfirm device into our practice was to address the needs of patients who have darker skin complexion. Because the success of the Sylfirm device to address certain skin conditions in the darker complexion individual was so effective, we really wanted to provide that to our patients who have slightly darker complexion skin. And here in Southern California, it doesn't make a high bar to reach that darker complexion. So I'm even including patients who spend a lot of time in the sun. So we really enjoy providing that service for patients who would benefit from the Sylfirm technology, who have darker complexion skin, to address certain skin conditions they have. Now, on top of that, including the SmartLaze laser really takes that treatment to the next level, because we can take a CO2 laser technology, really dial down the treatment parameters without compromising the aesthetic results, because we know that there are certain parameters that we can modify, for example, decreasing the heat, maybe the depth, and still getting a really effective treatment with the SmartLaze, especially when it's combined with the Sylfirm. And so that combination treatment, it's not a very long treatment for patients. It's really well tolerated. Our physician's assistant, our nurse practitioner do those treatments in our practices. So for me as a physician, again, kind of growing a practice, and for those individuals who are thinking of incorporating technology, these technologies are really appropriate for extended providers to use to provide great treatments for our patients. When we were looking at topical applications of treatments following a skin procedure, like, for example, a microneedling and radiofrequency treatment with Sylfirm, we always wondered what can help further stimulate improvement in the quality of the skin for our patients. And so originally we're doing platelet-rich plasma treatments, which is an effective treatment for patients. But then with the advent of exosomes, we realized that there's some added value to using exosomes for those patients because the quality and quantity of the growth factors in those exosomes are really of a higher level in patients who may be of a more mature age. And so for those patients who maybe the platelet-rich plasma would be a good option, but we wonder how much and how good a quality their growth factors are, the exosomes is a wonderful option where I think the standard of the quantity and quality of the exosomes is really high. And then for that matter, frankly, from a practice management standpoint, having the exosomes available really is a more effective use of our time with respect to providing growth factor treatment options for our patients following their Sylfirm treatment.